Hello, my name is Dr. Sonya Dunbar, and I am affectionately known as the Geriatric Toothfairy. And I am a proud registered dental hygienist for over 33 years. I've worked in long-term care facilities, assisted living facilities, and with homebound older adults for over 20 of those 33 years. And I'm so proud in what I do. Today, I want to talk to you about the importance of daily oral care as we age. Studies have shown that 81% of caregivers that provide oral care for older adults feel confident in what they do, but still 21% of older adults suffer from mouth infections and decay. So today we're going to review some reasons why proper oral care is important as we age. Number one is comfort. If our teeth are hurting or if our gums are swollen and infected, we have problems eating, and that's not good for us. Number two, confidence. When you smile, if your gums are hurting or if you're missing teeth, or your teeth are cracked or dark brown, you don't have confidence when you smile, and that affects your way of life. And overall health is the biggest reason. We all know that if your mouth isn't healthy, your whole body isn't healthy. Your mouth is the way that infection and things get into your body most of the time. So if you have bleeding gums or decay in your mouth, that can make you sick. So your mouth is the window to health. So let's talk about some ways to keep our mouth healthy. Number one, brushing. As we age, it's imperative that we brush our teeth twice a day. Even before we age, we should be brushing twice a day. Brushing twice a day is important. I recommend an electric brush. Now, I like the electric brush because it helps me, one, brush for 2 minutes, which is recommended. And also, as we age, our dexterity changes. So when you brush with electric brush, it tends to do better than what our hands could do sometimes. The proper way to use electric brush is just sit it on each tooth and let it do the work. You do not have to brush with an electric brush. Sit it on each tooth and let it do the work. Electric brushes are amazing, and most of the time they time out on their own. It doesn't matter what kind you get, just get one that you can afford. Now, if you use a manual brush, I always recommend a soft brush, because if you use a hard bristle brush, sometimes it can make your gums recede and make your gums sore. Always use a soft brush, angle it at the gum line and go in short circular strokes. Angling it at the gum line, because some of those bristles should get up under the gums. It's important that you're not only brushing your teeth, but you're sweeping that plaque and debris from up under your gums. Number two, always brush your tongue. Thousands of bacteria live on our tongue. Brush your tongue every time after you brush your teeth. Remove the plaque and debris and bacteria off your tongue, and then do a good rinsing and get all of that out of your mouth. I recommend a non-alcohol or mouthwash, because sometimes as we age, some of the medications that we are on, like blood pressure medication or diabetes medication, some of those medications already tend to dry out our mouth. So you don't want to use a mouthwash that has alcohol in it. Now, the third thing is flossing. Yes, we have to floss our teeth every time we brush. Now, I recommend a floss brush or a floss pick. This is a floss brush, and you can just go in between each tooth. They come in thick. You can see it right there. You can get different sizes. That's a thick one. Or you can get a thin one. But these bristles go in between your teeth. Now, if you can use string floss, use string floss. But sometimes our dexterity doesn't allow us as we age. Sometimes our hands move and different things like that. So sometimes it's kind of challenging to get in there with string floss. But if you can, I encourage that. But also floss picks are good too. Now with a floss pick, you can use this end and go in between your teeth and get that plaque and debris out. Or you can use this end and kind of work it in there and go in between your teeth. I recommend going in between all of your teeth daily. After you brush, you have to floss after you brush. You can also use a water pick, but water picks do not totally take the place of flossing. So you can floss, use a water pick, or a combination of two, but definitely get in between your teeth. Another little tip I want to throw in there: if you have dentures, remove your dentures every day and brush them. Not just take them out and soak them, but brush them. Your gingiva up under your dentures need time to breathe. It needs fresh air. And that gingiva up under your dentures, that needs to be brushed too. Brushing your gums up under your dentures promotes proper blood flow, and it removes the plaque and debris and food particles that's on your gums under your dentures. Always brush your dentures twice a day. Take them out, let your gums breathe and get some fresh air, and then put them back in. you want clean, fresh dentures every day. Listen, oral health is health care. If your mouth isn't healthy, your body isn't healthy. Thank you, and bye from the Geriatric Tooth Fairy.